This is my dear, dear friend, Julie Bliss, physical therapist, and she just shared a great win with me. Do you want to share what your win was today?
My win today was, of course, to be here. That's a huge win for me. And to realize I can't please everybody in the world. I'm going to try, but it's good just to be confident in your own skin that you just need to do what's right for you and do the best you can, but never going to make everybody happy in the world. But I'm going to try today for you, for sure.
Yeah. And my win is working on letting go of control. I'm having lots of opportunities to do that. So I'm growing in that area, and it's not a fun one. You guys have any wins you want to share?
My win is I made it here in the wind from Helena. In the wind.
Yeah.
That's a win.
Yeah. Mare made her win was getting here in the wind from Helena.
I think mine is speaking truth to people even when they don't particularly want to hear the truth.
Wow.
And that's not easy to do sometimes.
Kay's win is speaking the truth. Not always easy. I don't think it's ever easy. No. Wow. Who on screen would like to share a win? Welcome, Erica.
Thank you. Hi.
Hi. We're just sharing a couple wins, and then we're going to dive into our class.
All right. My win, I was like actually an epiphany, which happens like once a decade. So that was kind of a big win. Oh, am I all frozen for you guys?
You're still on for us.
Okay, great. I'll have to switch to my phone audio after this. I'm having internet issues. I have been feeling really mad at my body for not, I've been feeling like my body was failing me. And then I just like realized I needed to switch it, and like I failed my body. I've not been taking care of myself the way I needed to, even though I was, I've been eating healthily, but I just mentally have not taken care of myself. And so I feel like that was a major win for me to have that mental shift. And I have control over how I take care of my body, and it's not the other way around, that my body's the one feeling me. So that's my major win.
Yay. That is awesome, Erica. That's a huge shift, and one that's going to allow your body to start responding differently. That's awesome. Yeah. I'm going to just take another minute or two. Anybody else have a win they want to share? And then we're going to dive in.
I realized after our conversation yesterday about support, and because we were talking about having a support class for my husband or somebody else's who feel like they're not supporting their spouse enough. And I came up with a list about 20 things, and I was like, man, my husband supports me, and I feel very spoiled now. Because he's been such a support to me, even though I've kind of been like, he doesn't feel like he's doing enough, but he really is. So,
that's awesome. And you told him, right, Brittany?
Not yet. He's been busy.
Tell him. That's wonderful. Sometimes we take things for granted and we don't realize what other people are doing for us. So that's a great win. Welcome, Trish. We're gonna get started. So normally in Doctor's Corner, what I do for those of you that are new is it's a chance for you to ask any questions or bring up any concerns, and we always respect privacy and confidentiality. We're doing it a little bit different because bladder issues have been coming up a lot lately, and I asked Julie to join us, Julie Bliss, my dear friend and an excellent physical therapist. So the first half of class today, we are recording so that other people can watch, and we're going to focus on and talk about some of the bladder issues that we all have. And then we will turn off the recording and we will go over any questions or concerns. And if we run out of time, guys, you can email me, or I will put together an email or video response for whatever we don't get through today. So does that sound good? So the first half of class we're recording, we're talking about the bladder issues, and I'm going to just let you take it away.
Well, I have been a physical therapist for over 20 years, and little did I know when I was almost done with PT school, I was in a small plane with no restroom, and I was going to have an issue possibly. And that is a great opener to say, I've heard a lot of stories from myself, my family, and a lot of my patients. So there's never an embarrassing story that you should hold back if you need to tell me a story, because I want you to feel very comfortable asking questions today. It is such a common problem. One year, about 15 years ago, I did a lecture. It was January -20, and I set up about 2 chairs for people to come to the lecture on urinary incontinence. 200 people came. It was scary. So my main thing today is you're not alone.
Yeah, absolutely. And that's one of our, actually, that's one
Yeah.
of our, that's one of our things here. You're not
Yeah,
alone.
You're not alone.
Absolutely. And, you know, you're going to have a chance to ask questions, but we're going to talk about kind of what's normal.
Okay.
Right? And what are some of the common problems that we see? And there are some different types of incontinence, and we're not going to cover everything today. We just don't have the time, but we're going to cover the most common stuff and
Perfect.
the thing that I'm seeing here. And one of the biggest things that I hear from you guys is that bladder issues are disrupting sleep, and you know how critical sleep is. So that's kind of like where I want to maybe start. But what's normal? Like, how often should we be peeing, and
Sure.
what should we be expecting to be, you know, considered normal?
That's a really great question. Normal is urination should be every 2 to 4 hours during the daytime if you're drinking fluids adequately. So the basic recommendation is 6 to 8 glasses of water a day, and disperse that through the day.
And I'm going to say that we actually recommend a little bit more,
Good.
or based on your weight and your activity. So that would be like a bare
Basic.
minimum, basic. Yeah.
Okay. The other thing about nighttime is we don't want to get up to go to the bathroom at night, but in my reading, we're saying about 1 time a night for people over the ages 65 to 70. That's kind of normal, basic information. So unfortunately, we hear a lot of people getting up multiple times.
So I'm going to poll you guys, and we've got 14 people on the call. So I want you to type in the chat, how many times on average do you get up at night? And you guys can just hold up a finger.
Oh.
Or fingers. 1, 4, 1, 2, 1 to 3. Yeah. You know, I'm hearing from people 3, 4, maybe even 5 times sometimes. 1 to 2, I would say is fairly normal. If it's more than that, it really starts to become disruptive to sleep. So that's a big issue. The other most common problem I hear from you guys, and please either type in the chat or you can unmute yourself. The other biggest problem is just frequency during the day. So
I think the funnest thing when I learn new training is usually your first client after your training is kind of your hardest, worst client. That happened to be a 16-year-old child who was going every 20 minutes to the restroom, and that's not normal. So just giving her a basis of normal, in 2 weeks she got her body back to normal. So just sometimes knowing what that is and retraining your nervous system is exciting. So I just want to give you hope today that I can't guarantee perfectness in this world for this issue, but definitely we're going to give you some really basic information that can help muscles and also your neurological system.
So that brings up, I think, a really huge connection. The brain and the bladder, how connected are the brain and the bladder?
Confusingly crazy connected.
Yeah.
And it's, I just would not want to be your urologist. It's a confusing issue, and there's a lot going on. And the nervous system, which is our brain and our issues, has so much automatic things that happen. We don't have to think about our bladder filling. It certainly tells us when it's knocking on the door to go to the restroom, but I just want to comment how amazing our bodies are, for sure. So there's basically 2 types of incontinence. One is stress incontinence, the other one is urge incontinence. So kind of sounds like more issues might be the urge incontinence. Urge incontinence is going too frequently, maybe getting up at night, and this is the brain bladder connection that is just kind of like somebody pulled a fire alarm in your system. So knock it off, right? So we'll give you some ideas how to knock that off. Just to kind of qualify, the other type of incontinence is stress incontinence. And we're not talking necessarily about mental stress. That's well, we all have mental stress, that's normal too, but the stress of gravity and pressure of coughing, sneezing, laughing, that downward pressure on your bladder system and your pelvic floor muscles. So basically, when we say stress incontinence, I would say that means maybe you're weak in your muscles. So that would maybe mean more of a strengthening exercise, which I'm happy to show you today. And unfortunately, a lot of people have that combination of mixed incontinence, which just means stress and urge. The combo, it's a drag.
Yeah, it really is. And it can impact socialization. It can impact quality life, relationships, wanting to go on trips or not go on trips. I will be very vulnerable and tell you guys that I have some issues with some of that urge incontinence, and it can affect everything. But here's what I've noticed for me is there are patterns, and I'll get to the same place or the same time of day, and all of a sudden I have to go so bad that I can't even hardly stand it. Like I'm going home and I'm about to open the door and it's right there. So there's clearly a very strong component of the brain and the habits with the bladder.
They call that in your reading of the key in the door issue. So if you read that, it's where you really want to have your door already unlocked, correct?
Yes.
Get out of my way. So let's talk about just one thing while we're on that topic. You know, there's so much automatic things that you can that do occur during urination or wanting to feel like you need to urinate. And so to change sometimes that reflex arc, so if you know that's going to be 4 o'clock going into the door, then maybe before you get out of your car, take 2, 3, 4, or 5 breaths to try to relax, to calm down your nervous system. The other way to change that reflex arc for all of your nervous system reactions is to do, we call it roll for control. So it's a pelvic floor exercise, and all you have to do is roll your knees in and out. So if you're sitting, I want you all to do this with me right now. We're not going to change the camera, but just spread your knees apart so that your legs are making like a V, and then bring your knees together. And you're going to want to do 4 to 5 of these quickly. So 1, 2, 3, 4, 5. So why does moving your legs and your thighs change anything with the bladder? It is because your pelvic floor muscle, which is like a hammock in your pelvis area, attaches to your femur, and your femur are your leg bones. So as you rotate your hips and your femur, it is actually changing a muscle contraction that you naturally can't feel in your pelvis area, which is right underneath the bladder, and it's kind of like your dam, so you don't leak. So it gives that also a muscle contraction, but it also gives that neurological relaxation for you.
Yeah, that's
said
awesome.
The pelvic floor.
The pelvic floor muscle, correct. It looks like a hammock.
What did you call it though? Roll?
Just a funny term, roll for control. And that,
Roll.
yeah,
Roll
so
for
that,
control.
that brings me up to the book that both Floyd and I like, Beyond Kegels by Janet Hulme. Her last name is spelled Hulme.
So if you guys have gotten a book list from me, it's on there because I do recommend it. And she's from Montana, and you trained with her, right?
Yes, I did train with her. Before I lecture, I read the bladder and bowel issues for kids.
Yeah, that's right behind the microphone.
Oh, perfect. Oh, yes.
How about like that?
Thank you.
I'll show you the other book too. Here. Beyond Kegels.
So let's get back to maybe more nighttime things. Let's discuss a recipe for success of things that you can try that are easy and free. So let's discuss eliminating basic things like caffeine and alcohol. Those are stimulants to the bladder. So if you want to say, I'm going to try 2 weeks of no caffeine and no alcohol, that would be something you have control over. The next thing I would recommend,
Which, of course, that's not going to be hard for you guys because
you're
doing
up.
that.
Yay, you're
Yeah.
ahead.
And I want to, sorry to interrupt you, Julie. A lot of, I know a lot of our members are women, and a lot of bladder issues are women, but they're not all women. And I think we've got Dave on, and there are definitely bladder issues for guys too. And sometimes that's a different issue, and I'll talk just briefly about that. But guys can have this overactive urge bladder too. So
lots of
Yeah,
male
lots
clients
of
over
guys.
time, for
Mhm.
sure. The other free thing you can do for yourself is reduce your water intake 2 hours before bed. The other tip for you is to be horizontal 20 minutes before you anticipate going to bed. So if that's longer than that, that's fine. We'll just say 15 to 20 minutes. So for instance, say you're going to go to bed at, you're hoping to be sleeping by 10 o'clock. Let's have you lie down on your bed or a couch or the floor. I don't care how you are horizontal. It can be on your back, it can be on your side, it can be on your stomach. This has to be gravity eliminated. So think about possible water retention in your legs. So we're just defying gravity by having horizontal. And that 15, 20, even 30 minutes if you wanted to. You could read a book, watch TV. I don't care what you do during that time.
Well, I do.
Oh,
Don't-
she
Yes, you guys know, don't get on your screens. Get off your blue light.
Good.
This is the time to practice your gratitudes or journal or make your to-do list for the next day. Practice your breathing, listen to a meditation. And I've even suggested, I don't know if this actually would help or not, but putting the legs up the wall. What do you think about that idea?
I think that's a bonus.
So,
Or even if you're backwards on your bed, if you don't want to get on the floor,
yeah,
then you can have your feet on your headboard or the wall if you don't want to
exactly.
get off the floor.
Mhm.
And then after that length of time, then you're going to go ahead and use the restroom. So hopefully that extra fluid in your legs has gone back up to the bladder, and then you can void before you try to go to sleep.
Perfect. Perfect.
What happens if you do wake up
Mm.
and you want to try to shut down that fire alarm? I'm going to tell you some theoretical things that you can try, which they're harder to accomplish than me just telling you them. So
Easier said than done.
easier said than done. So back to that role for control. If you're laying in bed and you're feeling that sensation of needing to use the restroom, and you know you haven't had fluids for a long time, and you voided right before you went to bed, what if it's just the bladder calling the brain, but there's really not enough urine really shouldn't be calling you? So you can do your breathing techniques that you guys I'm sure have discussed. You can go through a sequencing from head to toe of thinking of muscle groups being relaxed, or your jaw, your shoulder. So in sequence, that's called physiological quieting. That's in the book. The other thing to do is add that roll for control exercise to see if muscle contraction of the pelvic floor stops that reflex arc of telling your body to use the restroom. So again, if you're lying down, you would have your knees bent up. And then you would just rock your knees out and in 3 to 5 times, try to breathe through it and see if you can go back to sleep. That is much easier said than done. But what happens is if people just initially start going to the bathroom and then it starts adding up to 2 times and 3 times, when are you going to start telling your body or practice trying not to answer that phone call? The other thing back to normal is if you're going to use the restroom every 2 to 4 hours and have adequate fluid, instead of measuring your volume, we tell people about 7 to 10 seconds of urination sounds like a lot, but that's pretty normal. So if you're getting up at 2 o'clock in the morning and you just have a little drop or two, your bladder really wasn't full. So this is your neurological nervous system just calling you inappropriately.
Did I interrupt you?
No, but don't let me
You
forget
should
to talk
see us.
about this
You
work.
should see us on a walk. Anyway, the 2 of us. There's a couple questions here I wanted to address. Brittany asked, how often should we do the exercise? Do you mean the roll and what was it called?
Roll for control?
Roll for control. Is that what you're talking about, Brittany?
The in and out with the legs.
Yeah, the roll for
Yes.
control. How often?
That is as needed as you're getting that urge symptom, but I do want to tell you that you can do that exercise with a 10-second hold twice a day. So if you're having stress incontinence, that's weakness of the pelvic floor muscle, you're kind of on a more exercise program.
So the first way on an as needed, if I understand correctly, is more to distract the nervous system and get the body thinking about something else. Is that a good way to say it?
Yes.
And the other way is strengthening the pelvic floor,
Perfect.
which you'd want to do just like any other exercise on a regular basis. And then Joan asks, why 20 minutes before bed? She said been doing it an hour before bed. I think it would be just at least 20 minutes before bed.
Agreed.
Right? So if it's more than that, that's okay. Although if it's too long and you're still upright, then more fluid could be reaccumulating, I would suppose, from gravity. So find a sweet spot for you, but I think you need at least 20 minutes for that fluid to mobilize. What happens is that fluid goes back into circulation and then back through the bladder. So it needs some time to get there, at least 20 minutes. Yeah. So I want to talk just a little bit about the men for a second. Is that okay? And then, if you are feeling that strong urge to go to the bathroom and there's only a few drops or a couple seconds of urination happening, two things could be happening besides the inappropriate signaling from your brain. You may have what we call a bladder outlet problem. And that can happen to women, but it's more common to men because of the prostate. The prostate is a gland that sits right at the base of the bladder and goes right around the urethra, which empties the bladder, and it gets enlarged in men. That's what happens. And sometimes that actually obstructs the outlet or the flow. So then the bladder never really completely empties. And so you empty, if you think of a full bucket, if you only empty a few drops at the top of the bucket, it's going to be full right away again. And you just keep emptying that first few drops of top of the bucket. You never really empty the bucket. So the bladder is full, but it's never really emptying because there's a problem with the outlet. Now there are reasons why a woman could also have problems with the bladder outlet, maybe scar tissue, or maybe something like this, right? Bowel problems, we're going to talk about how those are connected. But if your bladder is not emptying, you may have to do those first little drops more often. Is that making sense? So you want to work on making sure that there's a clear and unobstructed outlet. And for men with an enlarged prostate, there are supplements that help with that we carry. There are prescriptions that can help with that. And sometimes surgery is necessary, but there's risks with that. So that's kind of last resort. And if there's something going on physically, structurally obstructing the outlet for a woman, it may need to be fixed. But how does bowel and bladder connect?
Let's go back to what's normal. Having normal bowel movements is every day or every other day. Is that what you are not
Every
saying
day.
Every day. Okay.
Every day is normal.
So sometimes what you'll see in some of the reading that we're suggesting, Dr. Loy has much better information that has transpired over time. And let's talk about the consistency of the bowel. I usually say like a soft ripe banana. That would be
Exactly. Ropes,
not
snakes.
Yep, not
Banana.
rabbit pellets.
Exactly.
Okay.
There's
Good to
actually
talk about
graphs that show this. It's called the Bristol stool chart. First time I heard that, I'm like, are you kidding? But really there is. If I've showed you the picture in my office, you know it's true. We're aiming for soft bananas or.
There you go. And as with many things in the world, we learn a lot of things from children. So in treating children with incontinence at night, like a lot of bedwetters, but they came to find out that a lot of those children were constipated. And so the rectal tissue is very stretchy.
Right.
And so if you're having too much bowel constipation, then that's going to actually laterally impact pressure on the bladder. So again, another thing that you can address and control on your own is monitoring your bowels and seeing if that also helps reduce pressure on the bladder, especially for nighttime issues as well.
Yeah, absolutely. So you guys know we are always encouraging you to notice patterns in how things are. And so if you're suddenly noticing you're having more problems with the bladder, ask yourself, well, how's my bowel habits? How are my bowel regularity patterns? Has that changed? Have I added something in my diet that's giving me more constipation and now I'm noticing my bladder issues more? So keep looking for those connections and patterns because it's all connected. It's all connected.
I think the other thing that I find interesting too, when you start asking people a lot of questions in reference to evening or nighttime toileting, they'll say, I'm getting up 4 or 5 times a night. I'm like, well, does it wake you up? No, it's actually their animal that's waking them up. And then once they're up, then they're going, just because they're up. And so that, to me, that's an interesting issue, just to kind of note your environment. And I think that's really not very healthy for your bladder. Your bladder and your urinary system really would prefer resting at night.
Right.
So just a little tip of things that I've heard over time.
Right.
Although I love animals, don't get me wrong.
Yeah. 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 Do you have any other things at top of mind?
I was just going to tell you the couple things that I would recommend for you guys if you're having the stress incontinence. And sometimes I've even given some of these strengthening exercises to my urge incontinence patients, and they've had progress and improvement. So it goes back to those hip exercises. So if you're sitting or lying down, you're going to go ahead and fold a pillow, put that between your knees, squeeze it for 10 seconds, rest for 10 seconds, repeat 10 times, twice a day. You can do that sitting, you can do that lying down. You can also get a belt or a TheraBand. So I have a green TheraBand here that's quite stretchy. You put it around your thighs, above your knees, double knot it, or a belt. Even your hands can give you resistance. And you pull apart, same rules apply. 10-second holds, 10-second rests, 10 repetitions, twice a day.
You can even do it sitting at a traffic light or during commercial breaks, or we call that habit stacking. If you're wanting to do something on a regular basis and you're forgetting to do it, tie it to something else that's always already happening.
And it's really hard for me to go through a talk without saying the word Kegel. So a Kegel is an exercise where you tighten and lift up and in. There's lots of ways to describe it. So when I've had an electrode on my pelvic floor muscle, which is the muscle that helps you do the Kegel exercise, I'm anywhere from 0 to 8 microvolts of strength. When I do the pillow squeeze or the band exercise, my strength of that pelvic floor muscle increases up to 24 microvolts. So it doesn't matter how I describe a microvolt. I'm just going to tell you that the knee squeeze and the band is strengthening the same muscle, the Kegel exercise. Nothing wrong with Kegels. I'm just giving you another way to get stronger faster.
Yeah, I love that. That's awesome, Julie. So, you know, a lot of this overactive and urge bladder problems is connected to the nervous system and being very stressed or in a sympathetic, the fight or flight, you know, state. And we teach you guys a lot of tools to help with that. But I just want to mention that you do some things to help with that too, such as craniosacral and dry needling. Do you want to just talk about that for a second?
Yes. It's just a really interesting way to help your body get more control and relaxation. I treat a lot of patients that have either anxiety or maybe even headaches or other stressful situations. I've certainly treated people with PTSD, and craniosacral is a very light manual technique of hand placements to help balance your brain fluid and cranial bones and part of your vertebrae in a more symmetrical way, so your body starts healing itself and can go into that calmer state. So it's something that I personally receive every month. Dry needling is, I have had one client that received dry needling in the low back area due to pain, and her urinary incontinence was significantly reduced. I have not read any research on that to correlate that, but needling also is the use of acupuncture needles, and it is to also help calm your nervous system down. So it's just a really fun job I get to do.
There's a lot of tools out there, and Julie's one of the people I highly recommend. I'm just going to end with a few tips on some of the other things that can trigger what we call an overactive bladder or urgency. And this is actually a handout that I'll have Jackie attached to the recording so that you guys will have this. But there are definitely things you can eat besides alcohol and caffeine, which you already mentioned, Julie, that will be triggers for a bladder urgency situation as well. So anything with bubbles and fizz can actually make bladder problems worse, even things like club soda and seltzer water, sparkling water. So this really comes down to listening to your body and paying attention to patterns. But being aware of it is the first step. Of course, caffeine and anything with caffeine. So that includes tea with caffeine and even chocolate, which has quite a bit of caffeine in it. So they recommend white chocolate over dark chocolate. I'm not sure about that, because what we know about dark chocolate is it's got great antioxidants, but it does have more caffeine. So you have to be aware for yourself. Citrus, for some people, can be a trigger for overactive bladder. You just have to pay attention. It's not that any of these things are bad in and of themselves, but they can be triggers for some people. Sometimes even other acidic fruits, such as pineapple, can trigger this, and tomatoes. Cranberries are an interesting one. Some of you know that cranberry extract can potentially decrease or reduce the risk of a bladder infection, but they can also trigger that overactive bladder. And if you're adding cranberry to your apple cider vinegar drink with lemon and you're finding your bladder's worse, well, you've got cranberry and lemon, and that might be a trigger for you, and maybe you have to back off on that. You just have to be aware. Of course, alcohol and certain spices. And I'm going to mention certain supplements too. I have found, this is again because I have personal experience here, one of the amino acids, taurine, which is a very beneficial amino acid, but it has a diuretic-like effect, and it has a stimulatory effect on my bladder. Quercetin is another supplement, and some of the supplements you might be taking have these things in them. And so it could even potentially be, if your bladder symptoms suddenly get worse, ask yourself, did I just start a new supplement? And look at what's in there. There may be something that's in there. Peppermint can be a stimulant. Of course, sweets, because those also create more inflammation. You guys know that. Raw onions, for some people, are an issue. And they mention dairy, but I'm going to, and processed foods, but I hope we don't even have to talk about that. So that's really all of the tips that I have for you guys. I'm going to open it up if there's just any questions for Julie, and then what we'll do is we'll stop the recording and just go kind of into our regular doctor's class, which you can stay for if you'd like. So questions from anybody for Julie or about what we've covered?
All these things would work for sneezing.
Correct. Especially the ones where you're squeezing or pulling apart.
Okay.
Mm-hmm. Yes.
So Kay asked, would these exercises help with that stress, the sneezing? Absolutely. Yeah. Anybody in Zoom land have some questions? Did you have a question, Brittany?
It just made me think, does that also relate to like if women are having issues on the sexual side of things, or even men have issues on the sexual side, if it's possibly because of the weak pelvic floor?
Wow.
I've had a lot of comments and questions about that before, and it is the same system of exercises that we just talked about. Correct.
It's funny, we were just talking about new classes, Brittany, and that's a topic that came up. So keep posted, guys. We might have a new class. Yeah.
Is there a way to tell the difference between if it's more on the bladder side or if it's more on the pelvic floor?
There are some therapists in town that use a biofeedback machine, and so you can do an internal insert or an external electrode to see how your pelvic floor is responding. And so that would be one. Sometimes when I've done that in patients, and I currently don't have a system for that, but I learned a lot from that, thinking, oh my goodness, your pelvic floor is fantastic. It's so normal. It must be the other bladder issue. And then I've had it flip-flop where somebody has no contraction of the pelvic floor, or it can't ever relax. So having that window with the biofeedback is helpful.
Yeah, so there's some ways you can test. I think paying attention to your symptoms is probably the most helpful. Like what circumstances and situations are you having symptoms or problems in? So I'm reading questions here. Yes, I will, Joan, I will provide that list. It will be a handout attached to the email. And Erica had to leave. Yep. Anybody else have a question?
Yeah, I do. I'm thinking, because we've done classes on the rewiring of the brain for different things, that would this have some effect about your mind over matter? I'll use those words as far as waking up at night and being like, no, I don't have to go to the bathroom. I just think I have to go to the bathroom because I have tried that and that works for me. If I'm cognizant enough to awake enough to think of it. But then I'll go for another 2 or 3 hours, and by that time it's time to get up. And it's so much better than jumping up and running to the bathroom just because I think I have to go. Whereas I'm wondering if that neurological thing has something to, because you said they are connected. Does that make sense?
I think you're hired.
Yes, yeah. So Kay said, is this kind of a matter of mind over matter essentially, or are we working on rewiring the brain?
Right,
And
right.
absolutely.
I would think it
Absolutely.
has to have something to do with it because it's like anything else where we rewire our brain to make a choice.
Right.
So I would think it has to have.
The goal is to try not to answer that call when it's waking up at night if it's reasonable.
Yeah, right.
So I think what you said was perfect. Good
Yeah,
job.
that was great. Weight, Jan, you typed in weight. I'm not sure if that's a question or is that an association you're wondering? I don't know if you can unmute yourself, Jan, and tell us. Or if she's still on, I'm not sure. Certainly being overweight could increase bladder symptoms just from pressure. I'm not sure if that's the question she has. And definitely the more your overall fitness is, the more your bladder pelvic floor is going to be fit too, in general. So.
Agreed.
So can you hear me?
Oh, there we go. Yeah, go ahead, Jan.
Sorry. I'm on my phone. So no, basically I've been accused of actually not urinating enough as a child and even into adulthood. I mean, is there actually a reverse? I mean, I don't get up at all at night. So is there a damage done?
The only thing that comes to mind, you're gonna, Julie is so much fun. We love to laugh. The only thing that comes to mind for me, Jan, and this is actually something that you and I have talked about before, is are you drinking enough water? Are you hydrating well enough? If you're hydrating well enough, you know, like Julie said, you should probably have to empty your bladder about every 2 to 4 hours. Of course, that's a pretty big window. And I think if you don't get up at night, that's great, as long as you're not dehydrated.
I think what I worry about too is seeing teachers and nurses going 8 hours and not voiding at all. So we just try to say,
Right.
you know, if it's really been 4 hours, you probably should go and train your body that way. Because sometimes over time, people's bodies get flip-flopped. So when they don't go so much all day, then they end up having night problems because their body still needs to void at some time and they waited too long all day.
True.
Right.
If you're willing to share, Jan, how often during the day are you emptying the bladder? You don't have to share, but.
Well, no, I mean, it's frequent now that you've had me drinking all this liquid.
Good job.
Well,
but it still hasn't changed. Then I just wondered if I have, you know, if that is abnormal at age 65 to not have to get up now, because you said it's perfectly normal to get up once.
I
have
think
no-
that is
I think
so
it's a
good.
blessing. It's a
Okay.
blessing.
Yeah. We're just trying to have the people that get up once a night not feel so bad.
Yeah.
But you are fantastic.
We're all jealous of you, Jan.
Yeah.
Years of holding it in, who knows?
Well, yeah, it is. It's a balance. And so, right, finding the happy medium. So
Thank you.
Good job.
this was really fun. And yeah, we'll send the recording and the handout. I'm going to actually turn the recording off now because in the doctor's class, this is your time. Let me see if I can turn the recording off. Or Jackie, maybe, if Jackie's on.